here at the National Brain Injury Australia Conference, and I'm sitting with two very esteemed peers of their own practice, Professor Jenny Ponsford and Jill Huang. They are both from Epworth Hospital, where I was back in 1999, and they just delivered a very, very interesting panel discussion.
Yes, over many years, Eva, we've been following up people like you who've been through the hospital, who've sustained traumatic brain injury, and asking them about their sexuality, and find that the majority tell us that they experienced negative changes in sexuality, not only that decline in sexual function, but also their sexual well-being, their self-esteem, their body image, their confidence in relationships. And so having done that, we felt it was very important to start addressing this issue from a number of perspectives. And Jill came on board and has conducted some interesting research, actually talking to the people with brain injury and to the clinicians about how they feel about these issues and how they address them.
Okay, so would you like to take this on?
Yeah,
Okay.
I'll hold it. So basically, I interviewed 20 individuals with traumatic brain injury, moderate to severe kind of TBI. And look, it just came out that the journeys were so complex and everyone's different. And I guess that is the key point of good patient care, right? Good clinical care is that you treat everyone as different and you hear their stories and their journeys. And we found that just like with the rest of the research, a lot of the people we spoke to had a reduction in those sexual outcomes. And there was this sense of loss and resignation and not knowing where to find help, even though they knew they needed help. And so, through this kind of talking to them, we also kind of heard from them, well, what is it that they felt like they wanted their health professionals to do? Would they like them to speak about it, not speak about it? Who should talk about it? And again, very different. Some people said, yeah, it should be me. Some people said, oh no, I think the health professional should. And there was no right time. It was very much like, look, just ask me if it's okay to talk about it, ask me permission, and I'll tell you if I don't want to talk about it. And I think that's the main thing to take away from that is that clinicians can really just provide the opportunity. We don't have to pursue it, but here's the opportunity. Let's see if you want to take it.
Yeah. That's really exciting. So it seems like a great hurdle, a great part of the difficulty was actually broaching it with the actual clinicians. So
yeah, a lot of it was, role playing with them. They just felt so nervous about saying the sex word. But that said, although we've achieved it for the time being, we feel that ongoing training and support is going to be needed to sustain that change because there is still this lingering discomfort amongst the team and as you get new team members in.
Yeah. Do you think this is something that you could tool the actual clinicians to go on and to pass on the knowledge to
that's our aim,
Yeah.
I guess, and we've got these already within the team. The neuropsychologists have stepped up and they've agreed that they're going to routinely raise sexuality as part of their history taking and discussions with their patients, and we're just hoping that can go forward. But it's going to need to be built into staff education programs to be able to continue it on, and they need a lot of practice. And then the other issue, of course, that they raise is that when patients say that they have a problem, they want to know what to do about it. So the third component,
who
yeah.
wants to do what to do
Well,
about
so the staff, the clinicians say, well, we're not experts in sex therapy, what do we do? So to that end, we have also, and this was Eleanor Fraser did this as part of her doctoral research, developed a cognitive behaviour therapy intervention that is being evaluated in an ongoing way at Epworth. And that is therapy. It's got 12 different modules. It's very individualised, but it's designed to assess what is important for that particular person, and it might be just a person by themselves or a couple who is undertaking the therapy. Everything from undertaking psychosexual exercises, but also working on communication and self-esteem, self-confidence, all these different components. And we use whichever modules are appropriate. And we have found we've trialled it now with 16 people, sort of an 8-week intervention with the clinical psychologist, and we're finding that in every single case there has been a significant gain in their ratings of their sexuality, either during the intervention or during the follow-up phase. So we haven't been able to get large-scale funding to roll this out as a major clinical trial, but we're continuing it on a small scale at the moment, because I think it's the only work of this nature in the world that is going on.
Well, I'm quite amazed. I'm quite interested. What are the sorts of interventions that can you describe, like the process, or?
Well, it's basically just within the modules. It's talking through. It's a lot about communication. So, for example, married couples found themselves where one partner was tired all the time, or their behaviour had changed, and they were in the other partner was in a caring role, and so sex had gone completely off the agenda, and they were sort of 18 months post-injury and afraid to talk about it. So they were brave enough to come into the therapy, and in the therapy it's about not focusing on the sexual act, but just starting with tiny steps, like just working explicitly on how to show each other affection, making sure if they have kids that they have some time for themselves where there are opportunities. And they would have homework exercises, for example, not to have sex, but just to touch each other or engage in something that was making them feel good about themselves. Or if the focus was on we did have we did have men who had lost the ability to get an erection after their injury, and they didn't want to undertake the therapy with their wives because they were too ashamed. And with them we actually undertook, there was one man, we had psychosexual exercises, and he was, after 6 years, able to get an erection. Wow. And the other man had had very serious pelvic injury and was not able to achieve that. But for him, it was about reframing his sexuality, that it wasn't all about the sexual act, and how he could re-establish communication with his wife in a meaningful way without the focus on the sexual act. Yeah. So they're just some examples, but literally in the 16 cases, every one of them would have been different.
Because we're all as individual as a thumbprint. Every brain injury is as individual as a thumbprint. Yeah. So this is really exciting. I'm very excited about it.
I think it's the most exciting thing I've ever done in my entire career.
Pun not intended.
No, well, exactly. No, not meant. But it's so important and so unaddressed. And this session at the conference that we've just had is the first time we have been able to air it publicly, because every time we submit it to a conference, it gets a poster.
What do you mean it gets a poster?
Well, it's ranked lower on the list of topics, and so we don't get a decent forum in which to discuss it.
It's mind-boggling the way that the Australian society discounts.
Not just Australia. I think Australia's better. In the United States, it's actually worse.
Of course, though. Look at
they really don't say the S word. The UK is probably. That's the one time I did get us to give a keynote address on sexuality once in the UK, and they seem to be better able to speak about it.
Is there enough being done in this form of study? Can you envisage more? Can you envisage different approaches?
Well, as far as we are aware, this is the only study of its kind that's been done where we've tried to encourage staff to speak about sexuality more. Jill is just starting a postdoc, and our goal is to take this Australia-wide, but that is going to need money, funding, and so I guess that's our goal. It is very challenging to get funding in this space. So I guess, but our long-term goal is to run a full randomised controlled trial of the cognitive behavioural intervention and to translate this working with staff in centres throughout Australia and then throughout the world.
So, Doctor in Waiting, tell me what you're planning.
Well, so as Jenny mentioned, we're really hoping to take what we've done at the Epworth and just go nationwide. But I guess moving outside of the realm of research, we really need more health professionals to see it as a rehab goal, as a rehabilitation goal to work towards with people with brain injury, to let people with brain injury know that it can be a rehabilitation goal. And I think that's really the space that needs to be explored more, and we need more money to make that happen.